everyone. I, Megha Ahuja, welcome you all to Sashakt Dialogues, an attempt by Sashakt, the Ovarian Cancer Foundation, to break the silence and start meaningful conversations to combat unjustified cancer related stigmas. So, for this special episode in which we are going to discuss the stigma, anxiety, and depression, we have two amazing guests with us today. Divya Mathur, mom, cancer crusader, and an entrepreneur, and Dr. Prerna Khanna, Senior Consultant, Clinical Psychology, Max Super Speciality Hospital, Vaishali. Hi Divya, hi Dr. Prerna, welcome to the show. Depression and anxiety are not uncommon among people diagnosed with cancer. Stress is often a trigger for depression and anxiety, and cancer is one of the most stressful events that a person may experience. Starting with you, Divya, what has been your experience with anxiety and depression in your cancer journey?
Thank you, Megha, for giving me this opportunity. And thank you very much for addressing the elephant in the room, anxiety and depression. Not only for cancer patients, but also for a lot of people in a lot of seemingly difficult situations. So in my case, you can say that it has been a mixed bag. While I have been really lucky to have not slipped into prolonged states of depression, I have had my fair share. And the worst part is without even realizing that I was depressed. I have also faced a lot of anxiety issues, not just when we first got to know about the disease, but in every treatment, every relapse. And the worst part is even when the disease was in remission. So, if you ask me, Megha, my personal experience is, for me, anxiety is a little voice in your head, that makes you think of the worst case scenarios. Anytime you feel that, there is something happening in your body, any minute change that you notice in your body, and you get very anxious, So, small things like nausea, acidity, gastric, aches, cough, cold, just about anything. And the voice comes. Is it back? Is it spreading fast? What next? So, I have been blessed since these phases and mood swings were never permanent in my case. They were just transient. And also here I would like to emphasize that we did conscious efforts. We did a lot of things to keep myself away from, rather I should say, not to keep away from anxiety and depression, but to manage my anxiety and depression, because that is something it is very normal for a cancer patient, or for that matter any person going through difficult situation, to get anxious. So to manage my anxiety, we did a host of things, like from meditation to chanting to keeping ourselves occupied to focusing on various other things. And the most important one was, I think, to let go, to let go of things in a positive way. And another thing which I really followed all these years, last 11 years in my 6 relapses, was the principle of ABC, which is area beyond our control. So we have to really understand that there are certain things which are in our control and there are certain things which are not in our control. Like when it comes to medicine, treatment, I totally rely on my doctors. I have just told my doctor that, and I'm sure Dr. Prerna will, understand what I'm trying to say. That I tell my doctor that it is entirely up to you. I am in your hands. You can give me whatever medicine, treatment you have to give. What, as a patient, I have to do, my role is to just show up for the treatment and rise up every time I fall. Basically try to manage and not let the disease or the implications as in stress or anxiety or depression overpower you. That's what I have been doing. And as they say in Bhagavad Gita, that hey manushya apna karm kar, halki chinta mat kar. I follow exactly the same. I just have one thing in my mind, that I have to get up one more time. And in my case, Megha, it's been 6 relapses and it's been going on for last 11 years. Every time I think it's all behind me, it comes back. So I think, yeah, that's the only thing that I follow, and that has really worked in my case to manage my anxiety levels.
That's so inspiring, and I totally agree that it's all about identifying that voice and managing it. That voice will come. So it's very natural to get anxiety and depression, but to identify it and then to manage it in ways that can help you is very, very important. Coming to you, Dr. Prerna, depression is a common comorbidity in cancer cases. A cancer diagnosis is life changing and is a source of considerable psychological and emotional stress. What are the symptoms that one should look out for in order to know that he or she is suffering from anxiety and depression, and that he or she should consult a psychologist for the same?
Right. So, Megha, there is no denying of the fact that, with the diagnosis of a potentially life-threatening disease such as cancer, a myriad of emotions such as anxiety, sadness, worries do come up, just like Divya has shared. So it's not just that, you're battling a medical condition, but a lot of other psychosocial consequences can affect a person at multiple levels. There may be a loss of sense of security, there may be a loss of self-esteem, loss of an independent lifestyle, sometimes loss because of surgery or body image issue, hair loss. So there's a lot going on, psychologically rather than just at a physical level. So given all these impacts, it is not uncommon for them to experience all these range of emotions at some point or the other during their cancer journey, right from the diagnosis to even remission. Just as Divya said, that even when it is gone, you are constantly fearing that it may just come back. So what we need to understand that to a certain level, it may be normal to experience all these emotions especially in the face of such a difficult situation. But at a point when you feel that they are becoming persistent over a longer period of time, say for example 2 weeks or more, and they begin to interrupt your daily routine, you may feel as though things are much worse than they actually are, and make you feel that something is always sticking inside you. There's a lot of mind chatter going on that something's not right. So it is important to be aware of certain warning signs that it may be a sign of a disorder. So just to quickly run through what are the common signs and symptoms of these disorders, starting with, say, depressive disorder. So there is a sense of a continuous low mood for a long period of time, for 2 weeks or more. There may be a feeling of hopelessness, helplessness. A person may feel broody, tearful, and there may be lack of motivation to even carry out the daily activities, the daily routine activities. They may not be able to enjoy things that they previously did. There may be a social withdrawal. They may not feel like meeting with their family and friends, may not feel like socializing. So, and one of the symptoms of depression, especially in severe depression, that there may even be thoughts of suicide or self-harm, because the person tends to lose hope and they don't have the energy to carry on. So these are some of the crucial signs that we need to watch for. Similarly, in anxiety disorder, that there may be constant feeling of being edgy or jittery. They may be overthinking those thoughts. There's a constant feeling of dread, panic, or you can say an impending doom. A person feels that they have no control over the situation. They're losing control. There is excessive fear of illness and death, that you're not just able to brush it aside. And a person may get frightening thoughts, frightening images, frightening memories. And as Divya pointed out, it's very common for the person to become hyper vigilant for cancer symptoms. They're constantly scanning themselves, excessively scanning themselves internally for any possible signs of cancer progression, or say if they're in remission, there is a fear of relapse. So there's hyper vigilance. And a thought process that is very common in such patients is that of catastrophizing. thinking for the worst case scenario, just as Divya also mentioned, that they tend to imagine that from here, the worst case scenario, which is death. So they just jump to that stage and end up feeling more. That anticipation brings up more of anxious, thinking and worrying. And problems with sleep and appetite is also very common. They may be oversleeping or undersleeping. They may be overeating or undereating. So if a person finds that all these symptoms are persistent and they are not letting you carry on with your day-to-day life and also hindering your follow-ups with treatment, then one must get evaluated and treated by a mental health professional at the earliest.
That was quite informative. Everyone should look out for these signs while going through the treatment. Like even the caregivers around the patient should look out for these signs and reach to the doctor at the right time, because a professional help is a professional help. Like we as a family can try to do a lot of things, but I think when the line is crossed, then a professional help is definitely required. So coming to you, Divya, cancer is seen in a negative light in society and there are a lot of stigmas attached to it. It's common for cancer patients to take it as a death sentence despite all the medical advancements, which in turn leads to anxiety and depression. How can we change this?
The single biggest reason I feel for all these social stigmas attached to it, whether it is considering cancer as a death sentence or considering cancer, there are so many people who take it as it is something which is infectious. So all these social stigmas which are attached to cancer, I think the single biggest reason for that is ignorance. People are so ignorant about cancer, and why talk about others? When I was diagnosed, I also had so many things which were, not correct that I had in my head. So if you ask me, Megha, to get out of all these things or to change all these things, it's a very, very long process which will not happen just overnight. But yes, I think education, communication, and campaigns to highlight the disease, its causes, its treatment are the need of the hour. Whether it is formal education, whether we want to include it in our children's school ka curriculum, or we want to do social services messages on various mediums like TV, print media, radios, television, social media, pamphlets, billboards, and so on and so forth. The most important thing I feel is to talk about cancer. We just shy away from talking about the topic. We just don't want to discuss it. So the most important thing is we need to talk about cancer. We need to hyper communicate that cancer is not a death sentence. And I am a live example, Megha, sitting in front of you, like when 11 years ago, when I was diagnosed, my first reaction also was, kitna time bacha hai? Not bothered about anything else, but kitna time hai mere paas? And since then, like if you pick up medical records and medical history, for a grade 4 ovarian cancer, the life expectancy is not more than 5 years. But touchwood, by the grace of God and everyone's help and support, it's been 11 years and I'm like touchwood here and managing all that. So we have to communicate that cancer is not a death sentence. Another very important thing that I feel we need to do is to educate people, especially our women, about the need for not ignoring any abnormal symptoms or any changes that are happening in their bodies, till it is too late. So whether it is, a small lump in your breast, or whether it is, say, a case of some recurring abdominal issues, as the old adage, a stitch in time saves 9. It applies very well here to detect cancer in its early stages. Because if cancer is detected in early stages, it is definitely curable. So I think, if we do all these things and educate people, make them aware about cancer and about, all the social stigmas which are attached to it, which actually is not true, I think we can bring that change. We can change the attitude of the people towards the disease.
That's so very true. We need to downplay cancer as a society. Media also, it's very, very prevalent that cancer is always shown as a death sentence. Like the cancer patient, whenever you see in any movie, anywhere,
Yeah,
they show them dying.
Yes, I totally agree, Megha. And I always say this thing that, cancer is a synonym of death sentence only because of Hindi movies. जिस actor को, जिस actress को मारना होता है, उसको cancer दे देते हैं. I mean, there are most of other diseases, but it's just cancer. So, yeah.
Which is so wrong, which is why the whole fear around it is created. If anybody has diabetes or any other disease, they also have to make lifestyle changes to deal with it. But they're not told every day that they have diabetes. But with cancer, what happens is that the patient is told again and again that you are suffering from this, and the whole fear and the whole hue and cry created around it leads to more trouble than the problem itself. So, coming to you, Dr. Prerna, attitude plays a major role in dealing with any situation in life, including cancer. Two cancer patients with the same condition can have different outcomes because of their attitudes. What do you think can patient do to maintain a positive attitude during such tough times?
See, Megha, I do understand, it's a very widely held cultural belief, especially in our society, that, keeping up optimistic attitude can help cure cancer. But I only agree partially to this statement. Why? Because as of now, there is no medical evidence to support that keeping a positive attitude directly affects a positive, can have a positive outcome. Why? Because likewise, there is no evidence to suggest that people with, say, significant stress reactions or having significant mental health issues, it's not necessary that they'll be having a relatively poor outcome. Okay, so either ways, there is no cause and effect relationship as such between one's attitude and one's cancer outcomes. But having said that, being optimistic may not have an impact on the length of life, but it can certainly have an impact on the quality of life. A positive attitude can motivate a cancer patient to take better care of themselves. Following the diagnosis, they are probably more likely to eat well, exercise well, quit their negative habits like smoking, and practice other helpful behaviors in general. So in that sense, it can contribute to a person's overall sense of well-being. But again, I would like to add, that the whole idea to stay positive during this time should also not be overemphasized or already overtaxed psyche. So often, we hear people telling their loved ones that, you got to stay positive if you have to come out of this. So the person who's going through this shouldn't feel, as though they need to hide their painful feelings from their loved ones. They have to keep a happy face all the time or to look upbeat all the time in front of their loved ones, because it can further increase their sense of isolation, especially if the person is, undergoing any sort of depression or anxiety. So, as a society, we need to realize that it is okay to not always feel positive. In fact, one should allow them to ventilate their angers, their frustrations, their fears. It is just as important as staying positive. So the bottom line is they should be encouraged to embrace and express the emotions, whatever they may be, whether positive or negative. And that's why perhaps, many people find it relieving to work through their feelings, to talk about these feelings in support groups and in counseling sessions, where they feel heard and where they also hear other people's experiences and also learn coping strategies that work for others. Then, they tend to apply the same for themselves. So in that sense, the expression and embracing those emotions is more vital than just merely staying positive alone.
That's so very true. Like telling someone to be positive all the time can also create more stress than solving the problem. So yes, accepting your emotions and then dealing them is more important. Divya, at times patients feel low due to the tough treatment, but many a times it's due to societal reactions. People around create such hue and cry about the diagnosis that patients are left broken. I believe more than the disease, it's the social consequences that cause depression and anxiety. What is your take on this?
Uh, Absolutely, Megha. I totally agree with you on that point that it is not just the fear and pain of the disease in treatment which bothers you, but also the social stigmas which are attached to you, like from your karmic sins to sympathy bordering on futility to giving up to high bichari attitude, it like in one sentence, if I have to say, for me, it becomes like Karela, wo bhi neem chada, you know. So, and I had even written a blog on this sense and sensitivity. If you ask me, Megha, I'm blessed that my family and my social circle is sensible and does not ostracize because one has cancer. But yes, over the years, when in my counseling sessions, I have come across many patients who are made to suffer mentally, emotionally, psychologically just because they have cancer, and you'll be surprised and shocked to know that it is not just seemingly uneducated folks in villages and small towns, but it is people like you and me, it is families like yours and mine who behave like this, who talk like this, I mean, come on, except like a few like few cancers like lung cancer or maybe throat cancer and liver cancer, which are also caused due to your lifestyle issues, getting cancer does not mean that the patient is to be blamed, right? Cancer is like, if I can say, cancer is not an STD. Most patients are plain unlucky because they have an immune system which is not able to get rid of the root cells in their body. Also, one thing that I feel is that the cost of cancer can not just the financial cost. Okay, I don't mean only the financial cost, but the emotional toll, which is really huge on patients, families, and everyone around them. If you're able to build in some sensitivity and awareness, even if nothing else, it will make, how do I say, life much more easier for patients, for people around them, and for society by and large,
I absolutely agree. It's very important for people to be sensitive and be when they're talking to any cancer patient or survivor, they should take it with empathy and not with pity or sympathy.
Exactly.
Absolutely.
So, Dr. Prerna, family plays an important role in any cancer journey. What advice would you like to give to the caregivers of cancer patients who are battling anxiety and depression?
Yeah. So, Megha, if one has a loved one who has cancer, then first and foremost, I think they need to educate themselves about anxiety and depression and other mood disorders that they are at risk of. It's so prevalent. Almost 10 to 20% of the population with cancer also have a comorbid diagnosis of anxiety and depression. So the family members should make themselves aware what are the how to identify the warning signs, how it can affect the person, and how it can be treated. So if the caregiver notices or suspects any symptom, then they should ensure that the person is evaluated and treated by a mental health professional. Sometimes people with depression may not even recognize or acknowledge, or they may not be aware that they have depression. So they may end up feeling that it's normal to feel that way. And all too often, we see people, they say that they will overcome it merely with willpower alone, but and they don't end up seeking treatment. But depression is something that rarely gets better on its own. One must get treated at the earliest, otherwise it has a possibility of getting even worse. So the first thing is that caregivers should themselves be aware and watchful of the warning signs. There should not be any stigma in seeking out help from a psychologist or a mental health professional for evaluation and treatment. Secondly, there are few things that caregivers can do at home that can help patients with anxiety and depression. Firstly, caregivers can try and create a regular routine for a patient with depression, as it's really helpful in making them feel more in control. offer to, schedule a routine for the patient, help them with recommended lifestyle changes given by the doctor, include a little bit of exercise, moderate or light exercise, modified yoga, encourage them to stick to their treatment plan, and helping your loved ones stay as active as possible, because physical activity has been linked to lower rates of depression, even scientifically. So that is one thing. Second most, perhaps the most important way to connect to a loved one during this phase, if they are dealing with anxiety and depression, is to listen. There is no better connection you can offer to the loved one than your undivided attention at this point. Encourage them to talk about their feelings with family, with friends. Remind them that you want to understand how they are feeling, and you're ready to listen to them at any time that they need to or are ready to talk. So sometimes just listening and being understanding is a very powerful healing tool. It can really help them reconnect to happy memories, to joys and laughter. So these conversations, because it helps the person realize that they still have an identity and is not just merely a case of cancer. And last but not the least, I really want to stress on the point for care for caregivers. Giving care and support during this time can be hugely challenging. Many caregivers end up putting their own needs and feeling aside, just to focus on the person with cancer. But if you're not looking after your own physical and psychological health, you won't be able to maintain for a long time if you don't take care of yourself, right? So you should not feel, as if your own health is not a priority, since you are not the cancer patient. So you may feel you have no time left for yourself to care for your needs, your hopes, your aspiration. But these very things, if you pay attention, give little time, take little time out, it can give you the strength to carry on, taking care of your loved one. So make time for yourself, find time to relax, get enough rest, get enough, moderate exercise. Try to take time in whatever you find relaxing, connect to people. Don't just isolate in, yourself. Don't hesitate to ask for help. Many times family and friends may be more than happy to, pitch in whatever possible way they can. So some caregivers also find helpful to talk to someone outside of their inner circle, such as a counselor or a psychologist, because with experts you may be able to talk about certain things that you don't feel you can talk with your family or friends directly. So that can really help you to express your own feelings. If you're feeling any sense of burden or guilt, you can be suggested ways how you can cope with these issues.
I absolutely agree. It's very tough time, not just for the patient, but for the caregivers as well. And taking care of themselves is also very important.
Right.
So before we conclude, what are the words of wisdom you would like to share with our viewers? Starting with you, Divya.
So Megha, actually, Dr. Prerna has said exactly, what I feel, and the same advice that I would like to give. The only thing is that I call it, a 5-point recipe. So the first one being acceptance. So, as Dr. Prerna said, that it is perfectly normal to worry. It is perfectly normal to feel anxious. It is perfectly normal if you are feeling depressed. The only thing is that, you don't have to sweep all your emotions under the carpet. You have to deal with it. All you have to do is to constantly remind yourself that you and only you have the power to deal with it. Only you have the power to deal with these handful of cells, which have gone rogue from the trillions of cells which are present in your body. So there's absolutely no need to hide your emotions. Whatever at any given point in time you feel like venting out your emotions, please do that. Don't sweep it under the carpet. Like today when I was coming here, I was actually debating, should I wear my wig, should I go with my wig, without my wig? Then I decided, no, you have to learn to accept the situation. You have to learn to accept the way you look or the way you are. So I think acceptance for me is very, very important. Another second point I would say is positivity. Now, again, as Dr. Prerna said, that positivity does not mean that you have to be, happy all the time, smiling all the time. No, I'm very positive and cancer is not bothering me. No, nothing of the sort. For me, positivity means whenever you feel like venting out any emotions, just vent out your emotions, but then get back, bounce back to life. Don't let it overpower you. The third point is action and activity. So, what I feel is that we should not be talking about cancer all the time. As I said earlier, when I was diagnosed, whosoever used to come to my house would only talk about cancer. And I don't know kahan se log itne sare cases ढूंढ के भी ले आते हैं, usko cancer hua and fala had got cancer and this happened with them, that happened with them. I mean, I don't feel the need to talk about cancer all the time. On the contrary, we should be focusing on doing something which is creative. We should keep ourselves busy. We should keep ourselves occupied, engaged. We should pick up a hobby or rekindle our old ones. Like in my case, I am actually lucky that in 6 relapses over the last 11 years, I have been able to revive my old hobbies. I've been able to pick up so many things which I've always been wanting to do. But because of, whatever, taking care of the house, taking care of the family, job, all these things, I was not getting time. So you have to understand to pick up something, keep yourself occupied, engage, and not think about cancer all the time. Fourth point of recipe, if I have to say, I think it would be don't sulk and don't be bitter. I think that is very, very important, at least for me, because I feel bitterness is a one-way street leading to an unpleasant outcome. Instead of being bitter, be better is what I feel. And last but not the least, as Dr. Prerna said, we have to reach out to people. We often do this mistake that we don't talk to people, we don't share our emotions. We feel like, especially anxiety and depression, we feel, what will people think? How can I say that, I am getting these mood swings, I'm getting upset about small things. I remember, when I was going through all that, many a times it has happened with me, small things which are so insignificant, Megha, that they really don't matter, but they used to bother me. For instance, मैंने किसी को बोला, please you keep this cup there. And if they don't keep it, it used to bother me. But that time I had no idea that, it could be because of anxiety or because of, I always attributed it to medicine. So, whenever you feel anything and you're not able to deal with your emotions, I think one needs to find a few people. It can be your doctor, it can be the hospital staff, it can be your fellow patients, your family members, friends, colleagues, anyone, but just go and talk to somebody, share your concerns, take their advice, and I think most of the time voicing your concerns also help, and to sum it, if I have to say, I think annual health checkups and a healthy lifestyle. Most of us these days have a healthy lifestyle, but I think annual health checkups are something which must be really encouraged, so that if at all there is anything like cancer or any other disease, why take only cancer? It can be diagnosed in its early stages.
That was so inspiring. Anybody who's listening to this and who are going to follow these 5 points, it will make their life really, really easy. Coming to you, Dr. Prerna, what message would you like to give to our viewers?
Megha, I think what Divya has said, she's very beautifully summarized whatever needs to be done in those 5-point recipe. There's not really much to add. So I'll very briefly sum up today's discussion with a quote that you're allowed to scream, you're allowed to cry, but do not give up. So because hope is what keeps us going. So to all persons who are affected with cancer and their families, we just need to remember that you are not dying of cancer, but living with cancer.
That was so beautiful. Thank you so much. Thank you so much, Divya and Dr. Prerna, for this insightful discussion. I'm sure our listeners are going back with changed perspectives. I hope that we as a society downplay cancer and treat it like any other ailment to make the life of cancer patients easier. On this note, it's me, Megha Ahuja, signing off for the day. Take care and stay sashakt.